For the first time, Canada has a national strategy to fight prescription drug abuse. It's a comprehensive 10-year plan, including dozens of sweeping recommendations. Christina Stevens reports.
24-year-old Andrew Lozier has been an addict since high school. He first tried OxyContin at 16, then became hooked on Hydromorphcontin, both prescription painkillers.
It's definitely a scary thing to wake up, in withdrawals, and the only thing on your mind is one thing, and you don't worry about eating or sleeping or having a shower or how your friends or your family are doing.
Now there's a national plan to help people like Lozier and reverse a growing trend.
Canada has seen marked increases in rates of opiate-related overdose and accidents and addiction.
The Canadian Centre on Substance Abuse has made 58 recommendations aimed at prescription drugs, including opioids, sedatives, and stimulants.
This is about correcting a situation we all agree cannot carry on as is.
The report calls for a countrywide surveillance system to track patterns of abuse. It suggests establishing prescription monitoring programs in each province and making legislative changes so physicians don't prescribe the drugs indiscriminately. The health minister says she'll review the recommendations.
This is a very complex process. It involves many partners. It requires a number of individuals, a number of organizations to be at the table.
It's a framework. It has to get legs, it has to come to life, and it only comes to life if all of us get together and start working.
The report also calls for special attention to be paid to First Nations. Some communities say they have a prescription drug crisis on their hands. As well, it calls for better coordination with law enforcement and better access to treatment for addicts.
All this stuff in my life, it's basically put my life on hold. I should have done and, been a lot further in my life than I am now, just from, trying one pill one time, 8 years ago.
He says if he got the chance to do it all over, he would. Christina Stevens, Global News, Toronto.